Good morning, YouTube family and friends. Hope you all had a great week. My week was, it was a week. Today is Saturday, August 23rd, 2025, and this is my week 74 results of being back on Mounjaro. And I'll talk a little more with what I'm dealing with my generalized myasthenia gravis and how the test is going that the neurologist asked me to try this week to help curb my tongue weakness. So, and I also saw for the first time a physical therapy person at the YMCA that works with CHI Hospital. So I'll start off. Let's get the weight out of the way. Last week I weighed in at 241, which was a 3 pound weight gain while I was on my cruise. But this week I put those 3 pounds back off. So to this morning I weighed in at 238. So I lost 3 pounds by just laying around doing nothing, except going to doctor's appointments. So I don't know what to think of it. That puts me at a net gain of just 2 pounds for the 74 weeks. So we're going to keep on monitoring that as well. Could be the medication that the psychiatrist has me on. I saw my new psychiatrist also this week. It's going to be my new permanent psychiatrist. And then I see my new permanent therapist next week, as well as seeing my primary care physician, the other psychiatrist from the immediate care facility. I have kind of like my closeout follow up with her next week, as well as some more physical therapy at the Y. It's going to be a water therapy. So I'll get into all that here in a minute. So, but anyway, if you haven't watched my last video when I talked about tongue weakness, go ahead and watch that. You'll see how my tongue weakened after talking so long. We'll see if it does it today. Uh, my my neurologist, Dr. Chen, asked me to stop using my nerve stimulator, my Inspire nerve stimulator for my sleep apnea. He asked me to stop using it for a week, and I have. It's been 5 days now, and because he thinks that could be the cause of my tongue weakness, because it is discouraged to have the Inspire implant if you have a neural neurology or neural issue, which I do. I have an autoimmune disease which affects the nerves, which affects the muscles, and so it was discouraged to have that, but I went forward with it anyway because there have been some studies where it actually worked for people with myasthenia gravis. Unfortunately, it looks like I'm not going to be one of those. I've stopped using it for 5 days, and though I'm still getting tongue weakness, especially when I eat, it has calmed down some. It has gotten a little bit better. It's not fully gone away by any means. So it could have been a part contributor to my tongue weakness. I don't know. I'm just gonna on Monday I'll send a message to my neurologist to give him the update and let him know that I did see some improvement, but not a full recovery of tongue weakness. So yeah, it'd be interesting to see if I experience the tongue weakness while I'm talking in this video today. It's already been over 4 minutes, and I'm still okay. I am starting to feel a little tingling in my tongue, so we'll see how well it goes. So, but yeah, that's the update there. And if I don't know what I'm going to do if he says you need to stop using the nerve stimulator, my Inspire device, because I hate using this damn CPAP machine. Uh, don't like it. And I toss it off sometimes at night without even realizing it. And I hate to think that I did this surgery to implant this for nothing. So that's going to be really depressing. Yeah, I'm going to have. I said I'm going to have a tough decision to make if he says that, which I'm sure he is going to say that. He's going to say that it's just it's hurting you with your MG. So, but we'll see. We'll see how it goes. I think I'm going to start using it again tonight and see how it goes to see if my symptoms flare up more or if it starts to flare up more. Like I said, it's calmed down some, so see if they flare back up again more. And that'll tell me for sure that it was nerve stimulator that was causing the tongue weakness. So, yeah, I don't want to have to make that decision. Just more. Oh, the new psychiatrist thinks I'm suffering more from anxiety than depression. So she started me on 3 new prescriptions and took me off the other stuff. The other stuff was giving me tremors, dry mouth, make me tired all the time. Well, her prescriptions, I'm still getting dry mouth with them, and I'm still getting uh, tremors with it. So, and yeah, and the tiredness isn't as bad. It still hits me. So we'll we'll see. I see her again on September 2nd, that Tuesday after Labor Day. So we'll see where we go from there. Uh, I also had a meeting with HR with my job because I'm still on FMLA, even though I've used up my 12 weeks. And we had a good discussion. And unfortunately, uh, they might have to replace me. I'm still going to stay employed. I'm still getting my pay. I still have over 70 days of sick leave built up, so I'm still getting full paychecks. I'm still getting my benefits, but there's a chance that they'll have to replace me. And if that happens, then if I'm ever to a point where I'm ready to go back to work, I'll have to reapply for a position. So, which is understandable. We are so busy at work, and I don't want to hurt my team. So if they need to replace me, they need to replace me. I'll understand. So, but uh, so I'm on FMLA slash short term disability. Even though I'm not technically on short term disability, it's on FMLX. I'm still getting full paychecks because of my sick leave I have used. I still have plenty of. She said, as of right now, there's my job, my insurance. There's 180 days that has to go by before it turns into long-term disability, which would be they're using the date of my surgery, June 9th, when I started missing work for the surgery. And so from that day, it's going to be in December when I'll have long-term disability kick in if approved by the insurance company. So they said if I'm still not working by sometime in October, that's when they'll give the go ahead to start applying for the long term disability. So it would kick in December if approved. So we'll see. We'll see what happens. I don't know what's going to happen. Uh, I don't know. Uh, I still got so much in my head going about, especially now with this nerve stimulator affecting the tongue, and what am I going to do about that? I don't know. It's just too much, folks. It's too much. Uh, so we'll see. I'm still not able to drive my second job, which is stressing me big time financially. Uh, my second job is I drive Uber, and I don't get paid if I don't work with Uber. So I didn't have enough money for bills this month, but thank God. Uh, Several of my credit cards that come due at the end of the month aren't actually due until next month. I usually pay my credit cards when right when the new statement hits, I pay them, make a payment right away. But I'm having to push those off to close to the due date, which pushes them into September. Otherwise, I wouldn't have enough money to pay them. So I'm stressing financially big time right now. So, uh, but I'm able to make it right now. Uh, I am getting my refund back for that first surgery back in March to have this nerve stimulator. I gave them an $1,800 deposit, and the insurance finally corrected their screw up, and they're paying the hospital. And so as soon as they receive that payment and get it applied, then they'll send me my refund back. So that $1,800 will be helpful. Hopefully, I get it early September. That will help me out to cover September billings. So all my bills in September. I'm hoping this new medication the psychiatrist has me on that I won't be as tired as the more I use it. And so, like I said, it's just temporary for till I steer again on the second, and then we'll go from there. So I need to be able to start driving Uber again. I need that money. So yeah, that's life, folks. I know everybody's got their own crap that they're dealing with, but it just sucks sometimes. So, but anyway, that's my update for you. I am taking my Mounjaro shot today, 7.5. So let's go ahead and do that. I just came out of the shower, so I'm nice and clean. So move this down here. Take off the protective cap. You'll see the needle and the little medicine already dripping. Move it to the unlock position. You can do your fatty part of your arm, your gut, or your thigh, like always. I always do my gut. Last week I did it on this side, but since this bruise still isn't healed up yet, I'm going to do it on this side again. So just got to be 2 inches away from your belly button. Here we go. A little blood. So I hit a little vessel. That's how simple it is to take these Mounjaro shots. They work awesome if you're type 2 diabetic like I am. It works awesome to control your diabetes. So yeah, I got family members who are on it, and it's helping them big time with their blood sugar levels. So it works. So if you're ever considering something new for your type 2 diabetes, Mounjaro works great. So, and it also has a side benefit of weight loss. If as long as you don't have any other medical conditions like I do, it kind of curbed the weight loss, but it's still doing great to control my diabetes. So, all right, that's all I got for you today, folks. It'll be interesting next week. My water therapy. The pool was down when I saw the therapist at the YMCA yesterday for the first time. So he just kind of did a test to see where I'm at. He did verify that my right side, my right arm, my right leg are showing weakness. And I'm right-handed, so my right side should always be stronger than my left side, and it's not. So, but we're gonna, if the pool's up and working next week, we're gonna start some water therapy. Try to build my strength up, build my core up. So to counteract the myasthenia gravis and just laying around all day every day. So we'll see how it goes. He gave me some at-home exercises to do. So yeah, we're gonna try to build my strength back up. So all right, that's all I got for you. Y'all have a wonderful weekend. And remember to enjoy life to the fullest, because you just don't know what life is going to throw at you at any moment. So be kind to each other. Enjoy your family, your friends. And they say, complete strangers, just be kind to everybody. All right. I love you all. Bye-bye.